Good morning, everyone. It's a pleasure to be here and to present for the first time in COP in the Portuguese stand one presentation about health and environment. So the theme, the topic of this presentation will be the footprint, how to reduce the carbon footprint of the healthcare sectors. And I will speak about the Portuguese sector. I'm Luís Campos, President of Portuguese Council of Health and Environment. My partner in this presentation is Christopher Gormley, the Chief Sustainability Officer of the NHS England. And I think NHS England has the most serious program of environmental sustainability in the world. So we have a lot to learn from England, and I ask Christopher Gormley to make his presentation.
Thank you, Luis, and thank you for having me here today. It's an absolute pleasure. As Lewis introduced, I'm Chris Gormley. I'm the Chief Sustainability Officer in NHS England. Firstly, just a very quick overview of our health system. So we're a publicly funded health system, free at the point of use, and we have one of the largest employers in Europe at 1.4 million staff. We treat 1.3 million people every day. We have over 200 healthcare providers and nearly 7,000 general practices. So we are significant. I and my team sit in a central overseeing body called NHS England, and we have 7 regional teams below us and 42 commissioning bodies, which we called integrated care systems. Our programme really started back in, although we have a history of undertaking lots of sustainability practices prior to this, 2019 was a key year for us. We launched our long-term plan for the health service, and it committed to producing a strategy which we delivered in October 2020, delivering a net zero NHS. And this was our core strategy for how we were going to decarbonise the NHS. It created quite a bit of momentum, lots and lots of positive feelings across the NHS, so much so that when we undertook a significant piece of legislation, which I actually led, to reform our health service in July 2022, we also included new legislation to ensure that all integrated care systems, providers and NHS England had a legal duty placed on them to think or consider or have regard to the climate and the environment in the decisions they take for the health service. The strategy itself that we launched in 2020 set some really quite ambitious targets. So the first key target is that by 2040 the NHS will reach net zero for all the emissions that we can directly control. So those are things you can see from the diagram, things like our estates, our travel and transport, the energy we use, and we have interim targets there which are also quite ambitious, but we're aiming for an 80% reduction somewhere between 2028 and 2032. Our second key target is that by 2045 we want to reach net zero for those emissions that we can influence. So a big part of those emissions, which I'll come on to in a minute, very much about our supply chain and how we're going to decarbonise our. So we think that's about 60% of our total emissions. Overall, we think our health system is roughly 4 to 5% of our nation's emissions. That's, in geographical terms, that's quite significant. We think that's roughly about the same size as a country the size of Croatia. So we've got whilst we do have solutions, we're also part of the problem here. I briefly just touched on how we think our carbon footprint looks. We can see that it touches every single bit of our health system. A big part of what you can see here is our supply chain, but we also talk about our NHS carbon footprint, which captures our buildings, some of the medicines we use, and some of the transport we use as well. And as I said, it stretches across all our different parts of the health system, whether it's mental health, acute, primary care, but the graph on the right gives an indication of where we see the hotspots, and it's really important to be able to understand that, to be able to tackle the hotspots in our organisation. Oops. Whoop. Sorry. So how do we think about it as a programme? Well, again, in terms of our footprint, we've tended to set up a number of different teams, a number of different leads across all the different areas of focus. So if we start to think about our estate, so 15% of our emissions are locked up in our estate. Beyond just our net zero strategy, we've also published a net zero building standard, which helps support trusts, providers and general practices to be able to think about how they're going to build their estate in future, ensure that it's not locking in carbon that's going to affect our targets. We have a scheme in England and the UK, which is called the Public Sector Decarbonisation Scheme. We have seen unprecedented access to that scheme from health bodies. We've now secured over £1 billion in funding to support upgrades to our estate. That's really important, not just for carbon, but in our particular estate we have it's a very mixed estate. Some of our buildings are hundreds of years old, but we can see in some places it's already starting to reap benefits. Places like Castle Hill Hospital in north of England, it's saving nearly £250,000 every month on its energy bills from installing solar panels. It's really impressive. When we think about our travel and transport, 14% of our footprint, we launched a travel and transport strategy at the end of last year, aiming and committing us to decarbonise our fleet by 2035 with our specialist ambulances a little bit later. We don't want to incur additional costs by replacing fleets early, but as vehicles are phased out, we expect to see low emission vehicles become the only option for the NHS fleet. And we see annual operational savings here potentially of £59 million a year in terms of operational costs. That much of that is locked up with savings on fuel, but also operational maintenance. And actually, we believe there's a £270 million potential value in wider societal benefits. So thinking there particularly about the air pollution and the size of the fleet. It's the second biggest fleet in the UK after our mail system. So the amount of emissions and the impact on public health, it's really quite a significant saving. Medicines, so we believe overall they account for 25% of our emissions within the NHS. This is a real success story for us. We can see real progress. Gases such as desflurane, 20 times the environmental impact of other less harmful greenhouse gases. It's the equivalent of a bottle of desflurane has the same global warming effect as burning 440 kilos of coal. So really important that we look to reduce some of our really potent greenhouse gases. Great progress in this particular field. We, from a position of using sort of 20% of our anaesthetic gases in 2019 with desflurane, we're now down to 3%. So we've made real progress, and that represents real savings in terms of our carbon footprint. I mentioned earlier our supply chain procurement, really significant. The NHS contracts with over 80,000 suppliers globally, and as you can see, from medical, non-medical equipment right through to food and other procured goods and services. So it's a real point of interest for us in the NHS to tackle. And as such, we launched our supplier roadmap in 2021. And the purpose of this roadmap was really to get our suppliers to go on a journey with us to be able to reduce their emissions. It's not something that we're asking to happen overnight, but incrementally to step up the asks in order to be able to understand how our supply chain is impacting the NHS and the healthcare more widely. So very briefly, in 2022, we introduced a new 10% net zero and social value weighting. So essentially, when you procure from the NHS, there will be a weighting to that contract which you have to demonstrate net zero or social value progress within your contract. In 2023, we asked that all suppliers with new contracts above 5 million to publish carbon reduction plan for Scope 1 and 2 emissions. And actually from 2024 this year, we've extended that proportionately. So those suppliers below 5 million, to where proportionate, also have to provide evidence. In 2027 and 2028, it becomes a lot more difficult. And actually, we're asking quite a bit of suppliers here, and we're on a journey with suppliers right now to understand what they need and what we need to be able to push it a bit further, so that they can report, publicly report not only their targets but their emissions, and also publish a carbon reduction plan for all their Scope 1, 2, or 3 emissions. And then from 2028, we're actually looking that for some product suppliers to the NHS, we'll work with suppliers to try and understand that methodology. We're still a couple of years away from that. We have great relationships with other countries. We, as well as Luis and others within the Portuguese healthcare ministry, we also work across other countries in regards to those supply chain or supplier roadmap commitments that we talked about. So we've been working with the US for a number of years to try and align procurement standards, but also we've expanded that to other countries such as Australia, Ireland, Norway, and actually we're beginning to talk more to others such as Netherlands, Germany, France. So it's a really exciting thing. It's really important, that middle point, that we show alignment and minimise the burden on healthcare systems and our suppliers. I talked earlier, 1.4 million staff in the NHS. This is actually really where we're going to decarbonise our health system. I've mentioned quite a few strategies and top-down initiatives. It's really ultimately about the people. There's some pictures here of healthcare clinicians either using e-bikes or through online appointments. But we have a number of initiatives where we actually try and drive change from the bottom up. NHS England runs a clinical fellowship programme. We have over 40 clinical fellows in our alumni now from multiple medical specialities and allied health professionals and nurses and midwives actually. So it's really important that we empower our clinicians to be able to, with the knowledge, to be able to take it back out into the healthcare system and spread the good practice that we're able to demonstrate. Our strategy does allow for some innovation and research as well. In fact, there's quite a big question here for us, I think, that we still haven't quite answered, but we're already starting to see a growth in research and innovation opportunities. We've recently launched a £30 million funding call through UKRI and our UK Research and Innovation and our National Institute for Health and Care Research. Really exciting opportunities, and I hope we're going to be able to announce something soon on a collaboration with a number of, or at least one university within the UK to think more about our care pathways and how we're going to decarbonise through a number of different schemes. We have a system called Getting It Right First Time in the UK, which is really about trying to spread best practice in delivery of care, and building sustainability into that is absolutely key. Back to governance just for a moment. So I talked about the structure of the NHS. What we also have following our legislation, which is really, really key, is a number of what we call green plans. So every single trust, every single healthcare provider of secondary care and our commissioning bodies has to have a green plan to explain how it's going to decarbonise to meet the targets that we've set nationally. And each organisation also has to have a senior responsible officer on the board who's responsible for delivering that plan. So it's really, really important to not only deliver from the top and from the bottom, but also make sure that each of these organisations has their own individual plans to bring those targets that we need to meet by 2040 home. And I think that's me, actually. Thank you very much. I'll hand over back to Lewis, perhaps, and perhaps questions afterwards. Thank you very much.
Climate change is the biggest health threat facing humanity, and every year environmental factors are responsible for 1 in 4 of total global death. Which kind of diseases are increasing? Cardio and cerebrovascular diseases, the respiratory diseases, cancer, the vector transmitted diseases, zoonoses, diseases related with the quality of water and food, the direct impact of the heat waves, and also mental diseases. I was director of emergency service in Lisbon in 2003 when we faced the threat of the SARS, and we had to change our priorities in the hospitals and prepare the hospital to face this pandemic. And many of the changes that we have done were very useful to the actual pandemic by SARS-CoV. But indeed, since then, we have a threat of pandemic every year, 1 or 2 threats of pandemic. What it means that this pandemic was an announced pandemic. But besides the climate change, we have many other many other effects and causes like pollution. This is human health effects of microplastics that they have a direct toxicity. They increase the oxidative stress, increase inflammation, translocation of genes, and cancer. And there is eco-anxiety, that is this anguish of the young generations facing their future. This is a survey done to 10,000 young people in 10 countries, including Portugal. And in Portugal, 80% of young people consider the future frightening. 37% of young people are hesitant to have children, and 77% feel betrayed by the current generation. But if the health system is important to face the challenges and this epidemiological transition and increased risk of unexpected events, is also responsible for this carbon footprint. In general, is equivalent to 4.4% of all global greenhouse gas emissions. In Portugal, the health sector is even more, is responsible for 4.8%. It would be necessary to plant more than 160 million trees to remove this CO2 from the atmosphere. This was already presented by Chris, is the origin of these greenhouse emissions in the healthcare sectors, where you know that 70% comes from the supply chain. So how Portugal is reducing this carbon footprint of the healthcare sectors? We have very ambitious targets at the world level. Our targets for the reducing CO2 emissions in 2030 is 55%, 65 to 75 in 2040, and more than neutrality in 2050. However, this is not a priority in the National Health Service, the Portuguese National Health Service. The environment must be in all policies, and it is not. Reducing healthcare environmental footprint should be a political priority, and it is not. Environmental sustainability criteria must be included in all decisions at all levels. We have to develop, publish, and implement good environmental sustainability practices in healthcare. We have to improve quality, and improve quality is improve sustainability and proximity medicine. We have to create services, environmental sustainability service in all the hospitals and health units, include criteria for net zero greenhouse gas emission in purchases and contracts, and to revise obsolete laws which are obstacle to sustainability in healthcare. So we made the evaluation of the carbon footprint of the analysis in Portugal in 2022. That is more than 30,000 tons of CO2. But we have other clinical areas that are not touched. For instance, anesthetic gases that you have seen are a target, very serious target in NHS England with very good results. They represent 5% of the healthcare emissions, and there are experience in very few hospitals to reduce these emissions of gases. Also, these plastics that envelope the surgical boxes is plastic sterilized, and by the Portuguese law is considered contaminated and then go to the waste. Also prevention, health promotion and disease prevention reduce disease burden and improves environmental sustainability. 80% of the cases of coronary heart disease, stroke, adult diabetes, and 40% of cancer cases might be prevented by dietary habits, physical exercise, and tobacco cessation. However, in Portugal, as in many other health systems, we only have 3% of our budget dedicated to prevention and to promotion of health. Also, better quality represents more sustainability. This is an example. In Portugal, 333 people in 1,000 does CT scan, NMR, or PET scan per year. And the average of this number is 254 exams into 1,000 people. So the carbon footprint of the excess of CT scan annually in Portugal to the OECD average is more than 9 million CO2. So if we reduce this overprescription of exams, we could decrease and increase sustainability. There's a lot happening at hospital levels and in different units. But in the NHS, Portuguese NHS, the program is too much concentrated in the energy field, in water consumption, material consumption, and building, and not on the clinical side. And there are not many good results. This is the electricity consumption in the Portuguese NHS from 2013 to 2020, where you can see that, for instance, in hospital care, we did not improve or did not reduce this consumption of electricity. However, there are hospitals that are working very well. For instance, this hospital, the unit of Entre Douro Voga, they installed the solar panels, LED lighting, they promoted the use of single-use devices, thermic protection, capture of anesthetic gases, reuse of rainwater, electric vehicles, and telemedicine, and they are achieving to reduce its carbon footprint. We are also launching a campaign to collect this plastic, the blue wrap, and to recycle in devices and other equipments. There is another good example of change. For instance, the seasonal vaccination started last year to be done in the pharmacies, community pharmacies, and this change had reduced the carbon footprint from 1,253 tons to 739 tons of CO2. So, proximity care, care integration, and telemedicine reduce patient journey and mitigate environmental impact of the healthcare sector. And people say, well, it's necessary to have a huge investment to get these results. It's a lie. It's a good investment at a mid-term and long-term. This is an example also from the NHS England, where they calculated that providing 100% LED lighting in the NHS could be achieved with an investment of £492 million, which would be repaid in 3.7 years. Over the next 3 decades, it would provide savings of over £3 billion. So, what are the challenges for the healthcare professionals? So, I think that the healthcare professionals have a great responsibility. We have to link health with environment and to say that climate change is a health emergency. And this was presented also by WHO ahead of the CO2 COP29. We have to integrate health in climate negotiations. And we have a particular responsibility because we are trusted messengers. This is a global trustworthiness index of professions where it was asked in 31 countries which was the most trusted profession. And 58% of people said it are doctors, only 13% said it are politicians. So it means that we have to raise our voice to say that we are not facing a problem of environmentalists or young radicals, but we are facing a problem that affects all of us. But we have to do this carefully, because combining fear with the feeling of impotence paralyzes action. We have been doing for some time. I was president of Portuguese Society of Internal Medicine in 2017, and we were the first internal medicine society to ask more engagement from the healthcare professions in this fight against climate change, environmental degradation. Also in 2022, we put together 41 societies, European societies, but also Middle East and North African societies doing the same appeal. And this year, in March, for the first time in any area of science, we put together all the Spanish-speaking countries with all the Portuguese-speaking countries appealing for this engagement in the fight against climate change, environmental degradation. And so these were the reasons why we created the Portuguese Council for Health and Environment. We are not only carers, we have to be advocates of the patients, and if we know that 1 in 4 people is dying by environmental factors, we have an ethical obligation to be engaged in this fight. The Portuguese Council for Health and Environment was created in October 19, 2022, and our objectives is to give a common voice to health-related organizations to intervene jointly on the issues of climate change, environmental degradation, and its impact on health, promote awareness, education, and research in this area, advocate the need for the health sector to reduce its ecological footprint, and to help the health system prepare to respond to the current epidemiological transition and increased risk of unexpected events. And we are now 92 organizations. The main associations, pharmacy, pharmaceutical industry, 7 universities, the private groups, 23 medical societies, all the professions related with health, also big hospitals, also municipalities, also technological companies. So there is a huge opportunities when we put together so diverse organizations in collaboration. One of our activities was creation of the International Course on Health and Environment that was made with the Public National Health School, and we are working with the societies to elaborate and publish recommendations for reducing the environmental impact. And this was the first recommendation published in last September about the impact of inhalers. We also created the Portuguese Observatory of Health Environment that intends to monitorize all the impact of climate change in health, but also the efforts of the health system to reduce its environmental impact. And we are doing for the first Congress, National Congress on Health and Environment in 7 and 8 February next year. And I invite all of you to participate and also to present your works, your practices, your examples of good practice that you are developing in your institutions. And I finish with a legend. I finished with the legend of the hummingbird. One day, legend has it, there was a huge fire in the forest. All the terrified animals watched helplessly as the disaster unfolded. Only the little hummingbird was active, picking up a few drops of water with its beak to throw it into the fire. After some time, the armadillo, irritated by all the ridiculous commotion, said to him, "Hummingbird, are you crazy? It's not with these drops of water that you are going to put out the fire." And Hummingbird replied, "I know, but I'm doing my part." So my appeal is that each of us have to do our part in our services. Thank you. So we are available to answer any question from you.
Boa tarde. Falou sobre a política, neste caso ambiental, e eu gostava de saber, num dos seus dados importantes falou que 80% de jovens sente-se ameaçado pelo futuro do planeta. A minha pergunta é a seguinte: o sistema educacional em Portugal está a ser atualizado e se estão a incluir estas questões importantes do clima desde a escola primária? Porque temos de ter em conta que isto é um assunto que já ultrapassa o domínio específico só da saúde, é um assunto já geral. E tendo em conta que temos que mudar o currículo, as disciplinas extracurriculares consoante o mundo, o que é que está a ser feito em Portugal para consciencializar as crianças sobre esta problemática grande das alterações climáticas?
Are you listening? Okay. So I will translate the question is what is being done in Portugal in question of education of young people and sensitizing the young people for these topics. My answer that I would like to say that we are doing a lot, but I have to say no. There is a gap, a shocking gap, between the importance of these challenges for all the people and also for the healthcare professionals and the inclusion of these topics in the education, pre-graduate and postgraduate education of healthcare professions. Even they don't know. In this article published in September about the inhalers, we asked 368 doctors if they knew the environment impact of inhalers. And only half of the doctors knew that some inhalers have impact on the greenhouse emissions. So we have a lot to do in relation to increase the education, introduce the education of the healthcare professions and at all the levels. In this survey, for instance, the people, the young generations, was the generation that knew least about the inhalers. So that is a problem, and that is one of the objectives of the Portuguese Council for Health and Environment, to increase this awareness and to increase this education. Thank you for the question.
I'd like to ask the same question to the panelist who's beside you, I forgot the name, because of the fact that I live in the UK, I live in Leeds, so it would be interesting as well to know what is the NHS raising awareness. Would it be good to include these climate change situations in schools, for example?
Yeah, thank you. Really, really good question. So, look, with our clinical staff, similar surveys, so they tell us that 9 in 10 of our staff care or want to do something in relation to sustainability or climate change as part of their clinical or NHS role, probably only 6 in 10 actually have confess that they have the time to do that. So there's a real appetite from within our workforce that they want to learn, they want to do more. As a programme, we have a number of initiatives which are really aimed at trying to get some of our early stage clinicians to start to embed sustainability as part of their medical training. Talked about our clinical fellowship, but we also have a number of courses which you can sign on to as a clinician, and voluntary courses, but with huge uptake within the NHS. So that exists. It's also really important. I think I sort of emphasised the bottom-up approach there in terms of our workforce, but also we want to try and push more learning into our board level discussions as well about the opportunities, not just in terms of carbon, but I would say so much of what we do can save money, it can improve patient outcomes. So there's a real opportunity, I think, in trying to get the training and the learning, not just at every level from bottom up, but also that our managers really understand the opportunities available within the health service.
Hi, Luis and Krish. Luis, so the question is for you. It was really nice to hear you and to hear your presentation. As you know, in Guimarães, in Portugal, we are very concerned about the outcomes of what we are doing for our in terms of our local action as well. And I wanted to ask you. You gave the example of we are putting too much effort on resolving the problem afterwards, so we are not putting the effort on preventing diseases, for example, and working in climate change in terms of prevention and sustainability in terms of prevention. Do you think we are using the same strategy as wildfires, for example, at national level, so we are putting all the effort in controlling the problem but not in preventing the problem? Do you think we can do more about that? And what do you have good examples of, for example, in other municipalities that are doing that?
Well, the municipalities are very important because they control the cities, and the cities have a huge impact in climate change. And they are very important because they can mitigate the emission of greenhouse gases, but also because they can protect people from the effect of the climate change. For instance, heat waves. There are a lot of strategies that the cities and municipalities can implement, and some of them are very effective, like painting the houses and the streets in white, or creating solar panels to reflect the light, or to creating shadow areas to protect old people, to increase the green areas, to implement biophilic architecture that mixes, puts the nature inside the people's house, and changing also the infrastructure of the houses. So the municipality urban health is very important. We did a workshop 2 days ago, putting together the university and the municipalities to speak about this, and also to increase the engagement of municipalities in this reduction of the greenhouse gases, but also in the protection of adapting the cities to the effects of climate change. If there is no more questions, I will put a question to Christophe. When I speak with colleagues from UK, they are a little away from these efforts of sustainability, and they say, well, we have a lot of work, we are very few, we have a lot of work in clinical assistance. How can we be involved in increasing sustainability? So which are your strategies to involve more, engage more the clinicians and also the healthcare professions in changing the behaviors in their services and also in their lives.
Thanks, Luis. It's a really good question. Look, it's not unique to the NHS, but I think we feel it quite profoundly at the moment that it's healthcare post-pandemic is under pressure. Clinicians are busy. Spare time is not a luxury for many of our clinicians. So I think we have to understand that first of all, and I think it's not a process of sort of saying, and you have to do this one extra thing on sustainability. So I talked a little bit about the fellowship scheme again, about keep rolling clinicians through our programme and bringing them on board and then going out and spreading those things into the system. But I also talked about embedding some of our sustainability messages into some of the more recognisable programmes which are seen as clinical improvement already in England and in the UK. So I talked about our Getting It Right First Time scheme that take a number of clinical pathways and talk about how you can improve your clinical pathways and your practice. And embedding sustainability into those practices really helps get clinicians on board and realise the improvements they can make, which are not just, as I said, carbon, they are patient outcomes, patient improvement, patient experience, and quite frequently cost saving as well. So those sort of combined messages, which actually also lead to a reduction in health inequalities if used and copied consistently across different parts of the health system. There's a really strong message there which clinicians will always buy into.
Thank you. So we are arriving at the end of our time. I thank you very much to you to come to attend this session. I thank you very much to Kizrom Gormley to come to this first session about health in the Portuguese pavilion in all the COPs. So it was really, we made history here. And congratulations for the efforts that you are doing, also the results that you are getting in your sustainability program. So, bye and thank you.